Welcome back to Medicine. Today we are going to talk about something that affects millions of men and their families around the world: prostate cancer. It's the most common cancer in men after skin cancer, but the good news is that it can often be treated successfully, especially when caught early. Hello, welcome back to Medickpidia. In the next 10 minutes, we'll break down everything you need to know, from what the prostate is to the latest in treatment and prevention. Our goal is to give you clear, reliable information that can help you or the men in your life. So grab a cup of tea, get comfortable, and let's get started. What is the prostate and what is prostate cancer? First things, what exactly is the prostate? The prostate is a small walnut-shaped gland that is part of the male reproductive system. It's located just below the bladder and in front of the rectum. Its main job is to produce some of the fluid that makes up semen. Prostate cancer occurs when cells in the prostate gland start to grow out of control. Most prostate cancers are a type called adenocarcinomas, which develop from the gland cells. Many of these cancers grow very slowly and may not cause serious harm. However, some types are more aggressive and can spread to other parts of the body. When the cancer spreads, it's known as metastatic prostate cancer. Who is at risk? So, who is most at risk for developing prostate cancer? There are a few key factors to be aware of. Age. This is the biggest risk factor. The risk of prostate cancer increases significantly after the age of 50, and more than 80% of cases are found in men over 65. Race. For reasons that are still being studied, prostate cancer is more common in Black men than in men of other races. Family history. If your father or brother had prostate cancer, your risk is more than doubled. The risk is even higher if the cancer was diagnosed at a young age. Genetics. Certain inherited genetic mutations, like changes in the BRCA1 or BRCA2 genes, can also increase the risk of prostate cancer. Signs and symptoms. One of the most important things to know is that in its early stages, prostate cancer often has no symptoms. This is why screening is so important, which we'll talk about in a moment. When symptoms do appear, they can include difficulties starting urination, a weak or interrupted flow of urine, needing to urinate more often, especially at night, trouble completely emptying the bladder, pain or burning during urination, blood in the urine, or semen, painful ejaculation. If the cancer has spread beyond the prostate, symptoms can include pain in the back, hips, or pelvis that doesn't go away, and sometimes unexplained weight loss or fatigue. It's important to remember that these symptoms can also be caused by other non-cancerous conditions like an enlarged prostate. But if you experience any of these, it's crucial to see a doctor to find out what's going on. How is prostate cancer diagnosed and staged? If you or your doctor are concerned about prostate cancer, there are several steps to diagnosis. Screening and diagnosis. PSA test. This is a blood test that measures the level of prostate-specific antigen, PSA, in your blood. High levels of PSA can be a sign of prostate cancer, but they can also be caused by other conditions. Digital rectal exam, DRE. During a DRE, a doctor will feel the prostate for any hard, lumpy, or abnormal areas. MRI. Increasingly, doctors are using magnetic resonance imaging, MRI, to get a detailed look at the prostate and identify any suspicious areas. Biopsy. If other tests are concerning, a biopsy is the only way to confirm a diagnosis. A small sample of prostate tissue is removed and examined under a microscope for cancer cells. Staging. Once a diagnosis is made, the cancer is given a stage to describe how advanced it is. This is often done using the TNM system, which considers the size of the tumor, whether it has spread to lymph nodes, and if it has spread or metastasized to other parts of the body. The cancer is also given a Gleason score, which helps predict how quickly it might grow. Stage 1. The cancer is small and confined to the prostate. Stage 2. The tumor is more advanced but still within the prostate. Stage 3. The cancer is spread just outside the prostate to nearby tissues. Stage 4. The cancer has spread to other parts of the body, such as the bladder, rectum, or bones. A simplified graphic illustrating the stages of prostate cancer appears on screen. Treatment options. What you need to know if you are diagnosed with prostate cancer: there are several treatment options, and the best choice depends on the stage of the cancer, your overall health, and your personal preferences. For slow-growing cancers, active surveillance or watchful waiting. If the cancer is low risk and not causing symptoms, your doctor might recommend closely monitoring it with regular PSA tests and biopsies, and only starting treatment if it grows. For cancers that need treatment, Surgery, a radical. Prostatectomy is an operation to remove the prostate gland and some surrounding tissue. Radiation therapy. This uses high-energy rays to kill cancer cells. It can be delivered from a machine outside the body. External beam radiation, or by placing tiny radioactive seeds inside the prostate, brachytherapy. Hormone therapy. Prostate cancer cells often rely on male hormones, like testosterone, to grow. Hormone therapy reduces the levels of these hormones or stops them from working. Chemotherapy. This uses powerful drugs to kill cancer cells and is often used for cancers that have spread to other parts of the body, such as the bones or lymph nodes. Newer treatments. There are also newer, innovative treatments like focal therapy. This is a minimally invasive approach that targets only the cancerous part of the prostate, reducing side effects. Methods include high-intensity focused ultrasound, HIFU, and irreversible electroporation, nanoknife. Targeted therapy. These drugs target specific weaknesses in cancer cells. Can prostate cancer be prevented? While there's no guaranteed way to prevent prostate cancer, there are steps you can take to lower your risk. Eat a healthy diet. A diet rich in fruits, vegetables, and whole grains and low in animal fats may help reduce your risk. Maintain a healthy weight. Obesity is linked to a higher risk of more aggressive prostate cancer, so staying at a healthy weight is important. Exercise regularly. Regular physical activity has many health benefits, including a potentially lower risk of prostate cancer. So aim for at least 150 minutes of moderate intensity exercise per week. Don't smoke and limit alcohol. Smoking is linked to a higher risk of dying from prostate cancer, and limiting alcohol intake is also recommended. The future of prostate cancer research. The future of prostate cancer treatment is very hopeful. Researchers are constantly working on new and better ways to diagnose and treat this disease. For example, a new drug called NXP-800 is showing promise in treating prostate cancers that have become resistant to hormone therapy. There are also ongoing clinical trials looking at more targeted forms of radiotherapy and new types of immunotherapy. Be proactive about your health. We've covered a lot of information today, and I hope you found it helpful. The key takeaway is this: while prostate cancer is a serious disease, there are many reasons to be optimistic. With early detection and the wide range of treatment options available today, the outcomes for men with prostate cancer are better than ever. If you are over 50 or if you have a family history of prostate cancer, talk to your doctor about screening. Don't be afraid to ask questions and be an active participant in your own health. Thank you for watching. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and share it with the men in your life. It could make a real difference.